Hi everyone, I'm Wahenya Doc. In this video, I'm going to discuss about pharyngitis, also known as sore throat. If you like this video and benefit from it, hit the like button, share, comment below, and subscribe. What is pharyngitis or sore throat? Sore throat is an infection or an irritation of the throat. So I want to show you in a diagram what consists of the throat. This is a diagram. We have the nose, we have the floor of the mouth, we have the mouth, and we have the tongue. And this is the brain. The brain is separated by the nose by a bone which we call the sphenoid bone. So the throat starts from the back of the nose. That is this point. This point is what we call the nasopharynx, or the throat that is on the back of the nose. Then we have the part 2 of the throat is this segment which we call the oropharynx. It's the part of the throat that is behind the mouth. And last we have the bottom layer of the throat, which is the throat that is found in the area around your voice box. That is what we call the laryngopharynx. So all this is the throat. It's important to know your throat or your pharynx. Medically, it's called the pharynx. What are the signs and symptoms of sore throat? One, we have pain or scratchy sensation that is you feel in your throat. Number 2, that pain is worsened by swallowing or by talking. Number 3, we have a difficulty in swallowing. Number 4, we have dry throat. For children will present with the refusal to feed because they are feeling pain while they are swallowing. And also they will present with the drooling of saliva. They don't want to swallow the saliva because they are feeling pain, so they will be drooling saliva. Also, they will have fevers, chills, and they might also have a runny nose. The sore throat also present with a headache. It presents with a general feeling of feeling sick, or what we refer as malaise. And also we have other symptoms that can present with pharyngitis or sore throat is hoarseness of voice, or you have a scratchy voice, and also you might be experiencing a cough. Now, what are the causes of sore throat? The most common cause of sore throat is infections or viruses that cause the following diseases. The viruses that cause common cold, they are called the rhinoviruses. We have viruses that cause flu, and also we have viruses that cause chickenpox, viruses that cause measles, viruses that also cause HIV, and viruses that cause herpes simplex type 1. Herpes simplex type 1 causes a viral infection which we refer as the cold sore. We also have other causes like bacterial infections. The most common bacteria is Streptococcus group A. This is the most notorious bacteria, especially in children, and when not treated, usually it can result to a heart disease we call rheumatic heart disease or rheumatic fever. Other bacteria, we have Neisseria gonorrhea. For those people who practice oral sex, when your partner is having vaginal gonorrhea and you practice oral sex, this can transmit the gonorrhea infection to your throat, resulting to pharyngitis or gonorrhea of the throat. Other causes, we have fungal. Fungal causes result from Candida albicans. Candida albicans is the main cause of oral thrush. Then we have other causes of sore throat. We have people who smoke. Smoking usually damages the epithelium of the airway. This will result to a sore throat. We have chemical agents or chemical injuries. Chemical injuries, these chemicals and other things like alcohol, like dry gins and whiskeys, can irritate your throat, resulting to a sore throat. Then we have allergies. Those people who are allergic to pollen grains, allergies to dust, allergies to dust mites, allergies to smell and perfumes. These allergies might cause you to have a condition we call allergic rhinitis. You can watch a video. I've done a video on allergic rhinitis. This allergic rhinitis can result to infection or irritation of the throat, causing sore throat. Then we have dry air. People who live in cold areas or high altitude areas, those areas have dry cold air. This cold air, if you breathe dry cold air, you might experience irritation of the throat. Other causes, we have muscle issues. When you speak too much for a prolonged period of time, or you sing or you yell during sports, these can strain the muscles of the neck. These muscles, when they are strained too much, they will cause a sore throat. Then we have other reasons like cancer of the throat, can result to pharyngitis, and also we have HIV. When you get HIV, you will present with a sore throat and other symptoms of common cold between 2 to 4 weeks after you get a HIV virus infection. You will present with a sore throat. What factors increase the risk of developing sore throat? People who are at risk of developing sore throat, we have children and teenagers. Children and teenagers aged between 5 to 15 years have a higher chance of developing sore throat. They usually get these bacteria, the Streptococcus bacteria, which is the most common cause of sore throat in children. Also, we have those people who are exposed to smoking or passive smokers. If your partner is a smoker, make sure they don't smoke near or around your children, because you and your children might have or take the passive smoke, and this one will predispose you to developing sore throat. Also, we have those people who take dry gins and dry whiskeys. This one will irritate your throat and develop sore throat. We have those people who have allergic rhinitis. Allergic rhinitis is the inflammation of the mucous membrane that is lining your nose cavity, your throat, and your sinuses. This is allergic rhinitis is caused by overreaction of the immune system to allergens. Allergens are harmless substances. Then we have people who have chronic sinusitis. Sinusitis is in inflammation of the lining of the paranasal sinuses. I've done a video on sinusitis, you can check it. These are the people who have chronic sinusitis, is that their signs and symptoms can go up to beyond 3 months. So they are at risk of developing sore throat. Then we have people who have low immunity or low immunity. Low immunity is caused by infections like HIV, diabetes, and drugs that treat cancer, and also some drugs that treat asthma and allergies. And last, people who are having orosets. Orosets can predispose you to gonorrhea, and the gonorrhea bacteria will lead to infection of the throat. How do we diagnose pharyngitis? Pharyngitis is diagnosed when your doctor may ask you questions about your signs and symptoms. Your doctor may also examine your throat and the neck region, and other fractures around the neck. Your doctor may also perform a laboratory test to confirm pharyngitis. How is pharyngitis treated or sore throat? Most cases of pharyngitis are mild and self-remitted. Self-remitted means they can recover on their own without taking medications. Other severe cases of sore throat may need treatment. We have prescription medications like antibiotics. We also have alternative therapies, and we also have supplements that help in those people who have severe cases of or recurrent cases of sore throat. What are the complications of untreated sore throat? One of the complications, we might develop what we call a peritonsillar abscess. Peritonsillar abscess is an abscess of the tonsil, or a boil of the tonsil. This is a serious medical condition. This one you need to rush to hospital. Then we have a complication like rheumatic fever. Rheumatic fever or rheumatic heart disease is infection of the valves of the heart. This is a serious complication, occur mostly in children who have a sore throat or pharyngitis. So make sure when your child has a pharyngitis, he or she get treated on time. That complication, we have what we call post-streptococcal glomerulonephritis. This is an infection of the kidney by a bacteria which we are calling Streptococcus. Streptococcus, we have said, is a bacteria that causes pharyngitis. So if not treated, this bacteria can move with blood and infect your kidneys. Fourth, we have otitis media. Otitis media, the neck is usually connected, or the throat is connected to your middle ear by what we call eustachian tube. This bacteria that cause pharyngitis can move through the eustachian tube and end up going into your middle ear, resulting to infection of the middle ear, which we are calling otitis media. And last, we have pneumonia. This bacteria can move down through your lower respiratory tract and enter into the lungs, resulting to pneumonia. For more content like this, follow and subscribe Wahinya Doc. Thank you.